Namaskar. This is Dr. Alok Roy from Calcutta Medica. Again, like every Saturday, we are here with you on various issues under the webinar banner of Health is the Ultimate Wealth. And I'm extremely thankful to our sponsors. Sometime at the end of it, I forget to give credit to our sponsors. This time, I thought I'll do it in the beginning itself. To Bengal Chamber of Commerce and Industries, who have been supporting us, taking our message to all their members. And of course, Rotary Club of Calcutta, Aviana, for being a very, very supportive member of this webinar. They have been taking it to all the Rotarians across the Eastern India and very far, far places. I know somebody who watches it from California. So that's a great encouragement to the team of Medica, who does participate every week. So we have been bringing a lot of interesting issues. So I was talking to Dr. Ishad Aggarwal, one of the brightest dermatologists, rather cosmetic dermatologists whom I met recently, got introduced to him through Dr. Roy. And then he was talking to me about skin aging. I thought our lady viewership will find it very interesting. Hence why I invited him and most gracefully accepted to be part of this Saturday webinar on what are the treatment for skin aging and how to address it. With this, without wasting time, I would hand over the mic to Dr. Ishad Aggarwal for his presentation. Ishad, over to you.
Many thanks, sir, for that wonderful introduction. And I just want to make one change here. I really hope that it's not just the lady viewership and a lot of men who would also come forth wanting to look younger, wanting to age more gracefully, because it's no longer a female domain. I can vouch for that because there are a lot of male patients who come to me wanting to look good. Having said that, let me start off with today's discussion. Many greetings from Kolkata to everybody who's watching it across Eastern India. And the topic for today is anti-aging medicine for skin. Now, this is a very, very wonderful topic, and I'm hugely, hugely passionate about it. And if we see the way our society is changing, the stratosphere, the way that we are living has changed. In today's day and age, like maybe 15 years back, if somebody was 40, people would say, Buddha ho gaya hai, that ab age shuru ho gayi hai. However, as of today in 2022, I know a lot of people who are in 40s, and they would still consider themselves to be very, very young. So our life expectancy has increased. We are living better. We are all working out. And therefore, we are all also wanting to look good. The second revolution that has come in is the need for people to be there with their pictures on social media. So that also adds to this desire of looking good and not wanting to look old. I can keep on concocting stories where people have come and said, we wake up in the morning and I see these lines on my face and I don't like it, doctor. And it's not because I want somebody else to compliment me. It's because I look into the mirror and I don't like what I see. And that's why I want it to be fixed. So anti-aging medicine is an evolving field, and it's definitely here to stay because people are wanting it more and more. Now, most importantly, how do we age? When that a person wakes up and finally says, oh, look, I think now I'm aging and I need to do something about it because I definitely don't like to see what I'm seeing. So there are a couple of signs of aging which we must understand. So how do you realize that you are aging, one fine day? So if you see your pictures and if you see, that your brow and your eyelid is kind of droopy, I think this is something that a women, viewership will really relate more to when they see that the brow arch has gone down. Dark circles, I think, is a very, very common concern. People come and tell me that I always used to look fresh and healthy. And now people have come and started telling me, ki kya ho gaya bhai, dhang se so nahi rahe ho, bimar ho, stress zyada hai, even though I'm not stressed in my life. And dark circles are showing more and more. Eye bags have started to form. Under eye wrinkles, especially wrinkles around the eyes, have started forming. A lot of women would come and tell me, the way we used to put our lipsticks before has come down because we can't put them anymore because the lips have thinned. There are lines around the lips. Overall, the skin turns to be more pale gray. There is pigmentation, and the face looks really, really sad. Like people have come and told me, we had beautiful jawline, and that jawline is not there anymore. Face looks very, very fallen and sunken. So these are concerns. If you have, and if you started noticing in your face, in your pictures, in the mirror, it's probably time that you would want to do something actively about the aging quality of your skin. So what really happens to our skin as we age? Just like a building has good pillars, our skin has a few pillars that keeps it supported. Now, these are the three important pillars for every person who is probably listening to it. Three important pillars that makes our skin youthful are collagen, elastin, and hyaluronic acid. Now, these are three things that are present in our skin, and they keep the skin taut, and they keep the skin firm, and they keep the skin looking like a baby skin. So, a lot of people come and ask me, how can we have baby skin? Now, the difference between baby skin and our skin is that baby skin has a lot of hyaluronic acid, which keeps it supple, which holds a lot of moisture and keeps it taut. So these are the three things that makes us look youthful. And of course, these are present in all these layers inside our face. Now, this is important for us to understand that, skin is not just one thing. There's so many layers, and these three pillars are present in all the layers, and that becomes very relevant when I discuss the treatment options for anti-aging skin. So what is really the goal of all the anti-aging strategies inside this, that we're going to talk today? The first and most important thing is that collagen, which is keeping the skin tight. This collagen, when it breaks down, it makes our face look very saggy. So we need to help and prevent the breakdown of the collagen, elastin, and hyaluronic acid. And we also need to add more and more of these three things in order to make our face look very young. And finally, now these are all, the first two are more of preventive strategies. The third one is a more intervention. Whatever damage that has been caused over the years to our face, to our skin, be it sagging of the skin, be it the dark circles, be it thinning of the lips, all of that also needs to be corrected. So the third step is an intervention step. So what truly contributes to skin aging? Now, there are two factors. One are things that we can change, and there are things that we cannot change. Now, look, if you are born with genetics which make you age faster, there's nothing you can do about it. However, there's a huge list of things that we can change in our life in order to look better, in order to look younger, and prevent our skin from degrading very, very faster. So before I even talk to people, this happens to me in every consultation where people come and tell me that we want flawless skin. And I tell them that work begins with you. My role comes later. The first step towards having a skin that is not going to age faster, and in fact, it will make our aging reversed, is a good lifestyle. I think that's also one of the reasons, people are noticing a lot of faster aging in today's day and age because of the hookah, because of the vaping, because of smoking, excessive drinking. So these are things that we would want to cut down from our lifestyle. Apparently, smoking and vaping, is something that is so common these days, and smoking really shrinks the cells. It makes our skin dehydrated and, contributes a lot to faster aging. Second big change in a lifestyle that I think we all should really make is a good active lifestyle. I don't necessarily mean that you need to have a gym membership. What I really mean is that you need to be active and jumping and going about your life instead of binging and Netflixing all the time. So I think these are two important things. The third and very, very important thing is sun exposure and light exposure. I think most importantly, we have, as a generation, we were never really taught to put sunscreen the way it should be. And that really adds over the years, adds to the chronicity of aging. Therefore, sun exposure minimizing and light exposure minimizing is important. And finally, mental stress. You know, a lot of times people come and tell me, doctor, itna botox kar liya, itna filler kar liya, fir bhi chehre pe wo glow kyun nahi aa raha hai? You know, and when you look a little deep into their life, there's a lot of stress. You know, when you are under a lot of stress, it releases a lot of free radicals in your body. And no matter what treatments you do, you can't glow. So cutting down on mental stress by making small changes in life, maybe breathing better, doing a bit of yoga and mindfulness. I think these are things that really, really add value and makes our effort and desire towards looking better much more faster. So let's take that out of the way and let's talk about what we can actually do for you. As a doctor, as a dermatologist, what is it that I can offer to you other than just, you know, talking about lifestyle changes? So the three important strategies of skincare, you know, anti-aging skincare are lifestyle change, as I said, coming to a good skincare routine, and then of course, skin treatments. Now, what are the basics of an anti-aging skincare? I think, you know, these three things, if we understand, will take out a lot of confusion from people's mind as to how to go about choosing skincare routine. You know, I get people who are applying maybe 19 to 20 different creams and products every day on their skin. And they're doing that because they are very confused, because there's a lot of information on the internet. They are on Instagram forever. There's an influencer who keeps on talking about 10-step routine and 20-step routine and 30-step routine. But my point is, you need to be able to do all of that. So I don't mind if you have like a 10-step routine. However, more important is how consistently over the years are you going to be able to do that. Therefore, let's make it very, very simple. Let's talk about basics. An aging skin loses a lot of moisture from their skin. When they lose a lot of moisture from their skin becomes more damaged. That is called as skin barrier damage. Contributing to the skin barrier damage is also continuous sun exposure, like I said, and therefore sun protection becomes vital. And then comes the more fun part actually is the whole gamut of active ingredients, each one of which has a different role, and we should gradually be adding in our skincare routine, preferably under guidance of a doctor to help you sort out the confusion. Let's talk about a few SPF rules. SPF or sun protection factor or sunscreen. Now, I would highly recommend for everybody who's listening to this today, use a broad spectrum sunscreen that covers not just your UVA and UVB light, but also infrared rays and the visible light. Because all of these rays can affect your skin differently. Therefore, using a broad spectrum sunscreen is really, really important. More so when you are traveling a lot. You know, in today's day and age, everybody is traveling. People are going to Goa even, 3 times a month. Therefore, having a broad spectrum sunscreen covers all of these issues, especially the traveling issue as well. Second most important mistake a lot of people do is they don't use adequate amount of sunscreen. Now, I tell people the 3-finger rule, you need to take these 3 fingers, put sunscreen in all the 3 fingers, and that's the amount of sunscreen you need to apply each time. Therefore, a bottle of a sunscreen should not last more than 15 days, but that doesn't really happen. People buy sunscreen and that one bottle lasts them over, say, about 3 months. And that's the fault. And that's why you get so much of sun damage. Third most important thing is to use the sunscreen even indoors. There's a lot of visible light. There's a lot of infrared light. There's a lot of blue light that comes from our gadgets. Therefore, using sunscreen indoors is very, very important. Now, the frequency of sunscreen application would be determined by your lifestyle. For example, if you are an early riser and you are going for a morning walk at say 5:30 a.m. in Kolkata, there's a fair amount of light, so you will have to put sunscreen even at that time. However, if you tend to wake up around say 9 a.m. or something, maybe using a sunscreen 3 times a day would suffice for you. And most importantly, we should not be underestimating the importance of physical sun protection, things like caps, hats, umbrellas, overall covering. They're all equally important. For, I tell a lot of people who play golf, it's really important that you wear the caps. I tell a lot of women to carry umbrellas. I tell people to wear covered clothing, loose covered clothing wherever possible, because physical protection, it beats the chemical protection any given day. and it's possibly also the cheapest form of sun protection that is available. Now, coming to the second most important part of the skincare routine is barrier repair. Now, our skin, major part and major function of our skin is to protect us. You know, our skin protects us from cold, from heat. In fact, skin is the largest organ of our body. It protects us from everything. But what happens with age? With age, this protection barrier kind of gets disrupted. Therefore, our skin becomes more vulnerable. Our skin becomes more prone to damages because of dryness, because of coldness. And, you know, we talked about hyaluronic acid, which locks water inside our skin. If the barrier is, damaged, a lot of this water escapes from our skin. Therefore, our skin looks very dull, dehydrated. Importance of this barrier becomes more so when we are, crossing our 50s, because the more we age, the more the barrier gets disrupted. Therefore, choosing a healthy moisturizer is important. For aging skin, I would highly recommend moisturizers that contain ceramide and natural moisturizing factors. I would prefer that people start using bland moisturizers. One of the best natural moisturizers available to us is the coconut oil. So it's not always that you have to apply fancy moisturizers containing fancy ingredients. Twice or thrice application of coconut oil on our body is very good idea, provided you do not have an acne prone or oily skin. So please do use moisturizer. And in order to trap moisture in the skin, you can even use like a layer of hyaluronic acid on top of the skin. Moisturize as many times per day as required. And I think one of the biggest myths people are having is that if you have oily skin, you don't need to moisturize. Now, let me tell you that if you have oily skin, you still need to moisturize, but you need to choose a very water-based moisturizer. And do remember, it's easier to spread a moisturizer on damp skin than it is to spread it on dry skin. So, try putting moisturizer every time you take a bath, because you just have to slather it on and it works like a charm. Now, coming to the skincare actives for aging skin, there can be a lot of actives. Everyday market is being flooded by some or the other actives. However, these 5 tend to be the most consistent ones, the most talked about ones. Therefore, I'm going to talk a little bit about all of them. Now, like I said, one of the major components of skin aging is uneven skin tone, pigmentation, patchiness of the skin. Now, these two ingredients in different concentrations, glycolic acid and azelaic acid, you can get these, bottles with products containing glycolic acid and azelaic acid. Start applying them at night. You do not have to start them together. You can just do that alternate nights, or maybe just one product at a time. The best product for wrinkles, of course, is retinol. Now, please do not expect retinol to make your wrinkles disappear. That's not going to happen. However, if you start putting retinol at a timely age, you're preventing more wrinkles from forming. Therefore, retinol is the holy grail of anti-aging skincare. Anybody who is above the age of 30 to 35 can start using retinol. The moment you notice that fine line happening on your face, start using retinol. However, a couple of precautions. Do not overdo with retinol, because it is also a very strong ingredient. You can end up with a lot of dryness, flakiness, irritability on your skin. Therefore, start using retinol only at night, maybe once or twice a week to begin with, in small quantities. Always moisturize afterwards, and use sunscreen 3 to 4 times a day if you're using retinol. And finally, coming to lustrous, supple skin that a lot of people who are aging want. I think 2 ingredients which make a lot of change here is niacinamide and vitamin C. Now, niacinamide is a product that helps to calm down your skin. So if you have redness on your skin, if you're feeling like your skin is irritable, if your skin is sensitive, using niacinamide is a good idea. And vitamin C is one of the most powerful antioxidants that we know. It also helps fight pigmentation. It is anti-aging. So consider putting vitamin C in your skincare routine. However, do remember that a lot of people are sensitive to vitamin C as well. And they do tend to break out. So with the products, there can be a little bit of a hit and trial and even some misses. It's not necessary that all the products will do great for you. However, if you once finalize your skincare routine, continue with it and do make your changes in consultation with your dermatologist. At this juncture, I would also like to tell you, while the information is present online, I'm also giving you some information today. It's always a good idea to be under guidance rather than ordering products online and putting them yourself. I've seen a couple of disasters happening where people have overdone. They stripped the skin off their, important barrier using all of these products, because at the end of the day, all of these products are acids and can really, really, damage your skin if you do not use them properly. Second important thing is, if you're choosing skin products, go for good quality skin products. There are a lot of replicas, cheaper replicas in the market. However, the efficacy is not the same. So you might want to just do 3 products a day, but all those products should be of good quality. So coming to the big draw, the anti-aging treatments. Now, it can be very, very confusing. I see a lot of people coming to me showing different kinds of Instagram handles where somebody is talking about one treatment, then there's another one who's talking about another treatment, and they're all very, very confused. And also, they come with a lot of misinformation. They are scared about certain treatments because they've heard wrong things about it, but they don't have a first-hand account of what can happen, right? So I'm going to today sort this confusion out. If you are somebody who's bothered about your age, if you're somebody who's not liking what they're seeing in the mirror, if you're somebody who doesn't like these lines and the skin sag, I think this is something that you would want to listen to and then make an informed choice and with a good skincare provider, so that you know what you're getting into. Now, I would like to divide the anti-aging skin treatments into 3 parts. The first one is the facials and the lasers. The second one is skin tightening. And third, of course, is the invasive one, which are the injectables and the surgeries. Now, medifacials and lasers. So we'll start with the topmost layer of the skin. Now, how have we devised these treatments? Like I had explained earlier, our skin has up to 5 layers, and each layer is aging differently, and therefore we need to be able to take care of all the layers in order to look better and look younger. So the medifacials and the lasers target the upper layers of the skin, the epidermis and the dermis. Now, why have we created these treatments and how are they different from a regular parlor facial? Because a lot of women come and ask me, doctor, we're getting facials done in a parlor, and what's the difference between your medifacials and those facials? Now, let me remind you that even though we do call them medifacials, at the end of the day, these are specifically designed skin treatments, okay, where we use very high concentration of actives and acids. Therefore, one, they should always be done in a doctor's setting. We need to do it with very, very good machines. And third, like I said, the difference is that with the treatments or the medifacials, you keep getting better and better results after every successive session. However, a parlor facial will only provide you decent result only for maybe a day or 2. A parlor facial is more like a quick fix, but the medifacials are more like treatments. So medifacials are best for people who have skin texture issues, like they have more open pores because of age. They have few fine lines that are showing. They want to improve the texture of their skin. They want the skin to look a little bit more plush. And they have a lot of pigmentation. So medifacials and lasers, for example, I would like to name things like Hydrafacial MD, or facials that contain the Q-switch laser. These are important medifacials that you might want to start getting done. The earliest age that I would highly recommend medifacial lasers would be, if somebody who just turned 30, that would be a good gift to yourself to start off with the medifacials. Now, medifacials are not just done because you have an actual problem. For example, somebody with a pigmentation would want to get a medifacial done. However, if you don't have a pigmentation and you just want to maintain your skin, like basically you have absolutely no issue at all, but you want your skin to maintain that way, so getting a medifacial would be a great idea to begin with. You could start with maybe 1 facial per month or maybe 1 facial once in 2 months. Do consider, I tell a lot of people, do consider medifacials like workout for your skin. You need to do it consistently in order to see sustained results. 1 or 2 medifacial is not going to do a miracle to your skin. Coming to the second important treatment group, these are the skin tightening devices. Now, a lot of people, they don't want to undergo surgery. A lot of women and men, they don't want to get injections done. yet they do want their skin to lift. Okay. So the two important treatments in this genre would be HIFU, which employs the ultrasound rays, and the radiofrequency typing. Now, if you check the market for these treatments, there are a lot of providers. However, I would recommend that these are not just simple treatments. They employ, focused ultrasound beams that goes inside your skin and tightens it from within. Therefore, you need to get them done at a very, very reputable center and somebody who knows how to use these machines. Number one. Number two, there are two treatments, HIFU and RF. Now, you might need both or you might need one of them. Your doctor will be able to decide it better. Just because you've seen that HIFU has worked for somebody doesn't mean it'll work for you also. Or if RF has worked for somebody doesn't mean it'll work for you also. So you need to be able to talk to your service provider about these two treatments. The advantage of these treatments is that these are in non-invasive treatments and have barely any downtime. But the flip side is that these treatments give you very subtle results, and they're best for people who want to maintain their age. The earliest I would want people to start these treatments would be in their late 30s. Somebody's just turned 35, maybe starting an RF skin tightening facial or a HIFU once a year would be a good idea for people. The advantage of HIFU is also that it breaks down a little bit of fat. Just people who've got chubby faces, people who are looking to slim down their faces, people whose faces become broad in the lower face over the years, they are good candidates to start HIFU treatment. Now, coming to the final prong treatment strategy is the injectables and the surgery. I'm not going to talk about surgery today because I'm not a plastic surgeon. I'm a dermatologist. However, I'm going to talk to you about other injectable treatments, which I'm hugely passionate about. And as an injector, I can tell you that I'm passionate about it because I get it done on myself as well. My entire family does it. So, that really takes away the question that are these safe? Yes, the treatments are very, very safe, but they're as safe as your doctor and they're as safe as your injector. So the common injectable treatments that we use in anti-aging strategy are the skin boosters, BOTOX, filler, and thread. Now let's talk about skin boosters. Not everybody wants a chiseled jawline. Not everybody wants a sharp nose or pouty lips or high cheekbones or a very killer jawline. There are people who just want to age gracefully. There are people who just want their skin to look healthy, their skin to look younger, their skin to look radiant, and their skin to look like baby skin as it always used to. Skin booster is a great treatment for these kind of people because skin booster is nothing but hyaluronic acid. Like I had explained the pillars of skin, hyaluronic acid was one of the pillars. It is that pillar that makes the skin look younger, makes the skin quality nicer, makes it look less greasy, makes it look more dewy, makes it look more glowy. So what we do in skin boosters is we just inject the skin booster in the superficial layers of our skin. The skin boosters merge with the skin, they hold water inside the face, and your skin looks naturally radiant. The beauty about skin booster is A, it is a painless injection. B, it does not increase the shape, size, change the shape, size, or structure of the skin. It just makes the skin quality better. So there's barely any downtime. You just have to do twice a year. In fact, people who cannot come to a skin clinic every now and then, people who've got very hectic lifestyles, people who smoke a lot, people who vape a lot and do not have the time or the energy to think about their lifestyle per se, and yet would want their skin quality to improve, skin booster is a good cheat code. Now I'm going to talk about cheat codes here. For people who do not want to modify their life and yet have good skin, skin booster is one of those cheat codes. And the beauty is, even if you are the busiest person on the planet, you just have to do it twice a year. Now coming to BOTOX, this is funny because the moment we say the word BOTOX, there are a lot of brows that raise because people have this funny idea about BOTOX that everything that is wrong with cosmetic dermatology per se is because of BOTOX. When that's not the case, because BOTOX is at the end of the day only a medicine. If people start abusing paracetamol, it doesn't make paracetamol a bad medicine. It is a medicine at the end of the day, and the results will be how your doctor and you want it to work, right? So Botox is nothing but a neuroprotein that was first invented to treat the eye disorders. Gradually, its use was there in neurological problems, and later, much later, in the early 2000s, is early start of the millennium is when we started noticing that Botox actually makes the wrinkles disappear. So Botox works by relaxing the muscles. Therefore, all the wrinkles caused by muscles, they don't form after getting a Botox done. Now, it is the most guaranteed way. When people talk about skin treatments and they ask me, doctors, have guarantee hai treatment kaam hone ki? One treatment where I give a 100% guarantee is Botox. Once injected, the Botox is definitely going to work. And second thing, a lot of women, they come and tell me about Botox, and I tell them I've got Botox done, and they are perpetually surprised because they said, आपने बोला नहीं होता तो हमें पता ही नहीं चलता. And that's because if you do it properly, the results of Botox can be so natural that nobody can identify that you've gone and done the Botox. And the best part is, again, for people who are very, very busy and they want lines to just disappear, they do not have time to do so much of skincare. It is a great treatment because you only have to do it twice or thrice a year. And it is best suited for lines around the eyes, on the forehead, on the chin, and definitely to give you a little bit of a lift over the lower face. So these are the kind of results that we get out of Botox. As you can see, the lines have permanently gone and the skin looks stretched and much more younger. So if you are somebody who's just woken up and seen the lines and you hate them, Botox is the 100% guaranteed solution for you. Similarly, another lines, these are very, very common lines. A lot of people have these lines over here that make them look very angry and unapproachable. And with Botox, once these lines are gone, the person's personality can look much more pleasing. Therefore, if you are somebody who has always been misconstrued to be very angry while you're not, it might be time for you to get a little Botox. Now coming to fillers. Now fillers, this is very important for anybody who's listening to this to understand that Botox only works for these lines, okay? Anything that goes inside the lip, anything that goes on the cheek, anything that goes under eye, anything that goes on the chin, that can also be filler. Now, fillers are very hard gels and they're injected inside the skin, and wherever they are injected, they lift the skin or they fill the skin. Therefore, fillers are more useful. For example, somebody who wants a little bit of a lift on the cheek over here, or somebody who wants a little bit lip, somebody who wants a better chin, somebody who wants these lines to go away, or somebody who wants the under eye hollowness to go away. So therefore, fillers are more important there. So these are the kind of results that you get out of fillers. You can see these huge lines around the lip corners, which were making her look very, very dull and tired and old. And fillers is a very, very quick fix to reduce these lines. Similarly, under eye hollowness, she could look maybe 40, but once the filler is done, we've taken about 10 years off her face just by fillers. However, please do remember the market is clouded and full of cheap fillers, which can be very, very harmful. So do, if you really want to go for fillers, go for mainly brands like Juvederm and Restylane, and do check your injector who has a lot of experience before they even talk to you about filler. Coming to the last part, which is a thread lift for people who don't wish to go for surgery and they've got huge sag on their face. Thread lift, also known as mini facelift, is a treatment where we put threads which are biocompatible, which means they are okay to be in your body. They're put and they are then tightened. That gives an instant natural lift to the skin. However, this has a little bit more downtime compared to a filler and is for a little bit more brave-hearted people. However, compared to the surgery, the downtime here would be far, far lesser. So I think with that, I would want to give a quick wrap to the discussion today. The bottom line for me here is that a lot of people want to look younger. However, there's a hesitation in asking and seeking treatments. Just yesterday, there was a guy who wanted treatments but was hesitant because for him, cost was a little prohibitive factor. And then when I asked him how much does he spend upon, maybe a bottle of Glenlivet per week, So that did put a lot of things in perspective for him, because it's all about priorities. You might want to embellish yourself with handbags costing 1 lakh rupee, or with clothes which you might or might not wear again. However, your face can be your biggest ornament, and invest into it and look beautiful forever. With that, I wrap it up. Thank you, sir.
Thank you, Ishad. Very well spoken, and I'm sure a lot of people would have understood who are better than us, better than men. The women would have understood. I would like to ask a question that you have given a lot of suggestions about the sunscreen, moisturizer. So now, normally, all men thought that whatever women they have it, retinol and other things are only for women. But looks like that men and women can share those items. Is it true?
Absolutely. Absolutely, sir. Absolutely.
So all that expensive 23,000 anti-wrinkles cream, which my wife uses, I can also use it.
For sure, you must. You know what I would say is that if there's a 23,000 rupees anti-wrinkle cream, I would rather take that money and put into Botox. There's more better chance of getting result.
Good. So, and I was very, very happy to hear that in my mind, the Botox was always a kind of untouchable. But what you have shown and what you have done is remarkable. It's a great, and it kind of brings a change to your face, which makes you less aggressive, makes you look more relaxed, and all those frowns and all disappear. So I think the beginning to the inner change is from the external change. So once you are more approachable, people can approach you, and that's what you said was so true. You spoke like a saint in a way. So thank you very much. I have no questions to ask. I'm very, very ill-equipped and ill-qualified, or not qualified at all, to ask any question, but I'm sure I would share your video with everybody, and whatever questions come forward to me, I'll pass it on to you. So sure. Thank you very much for being part of this webinar. All of you listening to us. Dr. Ishad Aggarwal is one of the very well-known dermatologists and cosmetologists. I strongly recommend him to you all, both men and women alike. Am I right, Ishad?
Absolutely, sir. I think this is the change. I've brought a change today.
Yeah, men and women alike, and stay healthy, and more than staying healthy, look healthy. With this, we conclude our this weekly seminar. See you next week again. Thank you very much. And Rotary Club of Calcutta, Vienna. Namaskar.
Thank you.